Now let's come to the trending topic of artificial intelligence. All of us are living in the digital age, and artificial intelligence is the flavor of the season, I would call it. Everything is about this. So some people say we are in toy stage, we can play with AI, but it's not trustworthy. Some of us also believe it's in deployment stage, so it's moved well past the toy stage. This is very interesting. Einstein's IQ was 160, and you know what's the current IQ of generative AI? 155. And my sense is that in a decade or less, the IQ of artificial intelligence would be 10x of Einstein. With that, you should be an happy person, because you would have a tool at your disposal that makes you very powerful. If your assistants are 10 times having an IQ that of Einstein, just imagine what you can do. But it won't happen till you master these tools. So this is the original AI functional pyramid model that I have created based on the work which I unveiled at the Global Digital Health Summit on the 19th of September this year. There are 5 levels of AI. While people will tell you artificial intelligence as one word, unfortunately in my work, in my deployments of AI, my research on AI, I have decoded AI into 5 levels. That's why I call it the AI functional pyramid, or what you may call the mental model of AI, what I call this. There are multiple names I have given it. I'll not be surprised someday that it becomes the Rajendra Pratap Gupta model of AI, whichever way it is. But at each level of deployment, there will be displacement, but there will be beneficiaries in the healthcare system. Let me start with the first one, conversational AI, which is chatbots. I gave it the name of talkers. These are original nomenclatures. This is not anywhere else, not copied. As I said, the Academy of Digital Health Sciences is about creating and shaping the domain of digital health and helping you lead that. What happens when you deploy the talkers? Anyone who sits and talks is gone. And so 24/7 helpline, back office, front office jobs, including clinical assistants. Please have enough forbearance levels to absorb this slide. This is what you are going to pass through in less than 5 years before the end of this decade. 2 beneficiaries, communication and cost. Whether you're a clinician, whether you run an organization, or whether you run the government. Reasoning AI. You know that AI has reached a level which can think like, educated, like PhD guys. Yeah, I gave it the name of thinkers. When AI starts thinking, and we have reached there, we are mature. We have built solutions, as I can tell you that, the work that I am doing, we have built and we are deploying solutions. At this level, they will replace some of the tasks associated with few health professionals and aiding medical decision making. Accuracy, diagnostics, and clinical outcomes will be the ultimate beneficiaries. So AI is like not a new thing. It started off in 50s, so it's been good 6 decades plus for that. And in that timeline, we have reached the talkers and thinkers level to a fairly decent level, I can say. The third level is autonomous AI. I built a solution on that with the world's tallest leaders in this domain. Not one of the world's tallest leader in the domain. I gave it the name of doers. So talkers, thinkers, and doers. Some touch points in healthcare, some specialties, some procedures, primary care physicians, second opinion referrals will get deeply impacted with this level. But this also means that there will be a wonderful partnership between the human and the machine. And this will impact systemic efficiency if you run an organization and efficacy of the treatments. So you've understood three levels: talkers, thinkers, and doers. This is what I'm most excited about: innovating AI. Where AI can innovate, I give it the name of innovators. End of 18th century medicine and symptomatic treatment. So I give you an example. I'm diabetic. So for a long time, and I would say that I'm diabetic for a very long time. So typically when you go to an endocrinologist, they will give you very safe medications in the best interest of the patients is glimepiride and metformin, which I have been taking not too much, I would say, relief. So I spoke to one of the doctors who took our 1 year course in digital health, and I said, look, this is it. Now that you've done the course, what do you suggest? And as I expected, clinicians who do the course become the best doctors for their patients. He said, I can't treat your diabetes. I'm sorry about that. But I asked him, why can't you? He said, you need to get a gene test. And he told me it's the maturity of onset of diabetes in young, Mori's test. And when the results came, he said, yes, now I know what I need to do with the treatment. So after the gene test, I also realized that there was some of the medications that I was taking, and one of the major ones won't work on me. So my medications have been changed and I'm much better off. So just imagine what happened. The guy who's trained in digital health has treated the genotype and the phenotype in me, and not just the phenotype which doctors have been treating me for decades. Also at this time, quantum computing will get into healthcare. I'll give you an example. My Modi's test had 5 plus GB data, genetic data, which was analyzed. I think if you do a complete genetic test, it would be much more data. Conventional computers cannot do that. Conventional computing cannot do that. So quantum computing will get into healthcare at this stage. But what I'm most excited is this: new clinical pathways, new drugs, new devices. You can be rest assured, and I tell you with full knowledge and responsibility, none of you will be doing what you do today by 2030. It will be quite different. I say this not just because I am teaching you this. We are also creating. We are teaching because we are creating, and not the other way around. So make sure that at every level that you have learned, you are ready for it. The courses that we run are supposed to prepare you for the 5 levels of AI besides others, as I said. Because AI, I repeat, AI is a collaborative technology and doesn't work on a standalone basis. And that's what this course does to you. So what level 4 does is preemptive care. Now that you have learned talkers, thinkers, doers, and innovators, let's get to organizational AI, where you can run an entire organization with AI with just the human framework and maybe a random chat. I give it the name of leaders. End of a 3-tiered healthcare system. We will partly or fully replace HCPs. While when I say this, for some of you it will be like a matter of disbelief. But those of you who attended the United Nations high-level meeting of the General Assembly and the Vices Plus 20 review, you would have seen the number 2 side session hosted by Health Parliament. It was about creating a new health system. We are also creating a new health system which will deliver in the next 2 years. So I believe that digital health will be one of the core technologies that will impact the new system and also lead it, besides other things that we're going to cover over the next 2 years as we engage global leaders and grassroots workers on developing the new system. But overall, remember that this functional AI pyramid that I have developed could be your guiding light to change your practice, prepare your organization, or lead your country for healthcare. If you're a Minister of Health or the Secretary of Health or an official of the Ministry of Health, I strongly encourage you to go through these courses and be ready so that you are not taken in for a shock. Technology is not going to wait for you. It will also lead to predictive precision and personalized medicine, what I call the golden era of medicine. I call it the great reset. For those of you who are doing this course, you are preparing your organization, your practice, your patients, your country for the great reset that's going to come. And that's the golden era of medicine. Most of the things would move from hospital to hospital. Things will follow to people at their homes. And hospitals will just be confined to doing surgeries and procedures. Nothing else, nothing less, nothing more. And from healthcare to health, and will not be a patient-centric health system. It will be a health and human-centric system. So you understand that whatever you have heard of AI, when I say that we are the world's best courses we offer through our academy, we mean this. While the first lecture always gives you a glimpse of what's coming, but I can assure you the subsequent lectures are much more interesting. So for those of you who believe that, while these shifts are fine, what has it to do with me? Well, yes. For some of you who have known my background, that I am into healthcare for a long time, but I am also a policymaker. I write policies for my government, and I write it, for all sectors. So I track millennia. I don't just track decades. So it gives you a sense now. For a large part of human history, those regions, when countries didn't exist, who were strong in agriculture, were strong as a region. India has predominantly been an agrarian economy. It had 27% of the world GDP. We were strong in agriculture. But times changed. Then came the time when you were strong in military, the firepower, you ran the world. So UK and United States ran the world. Then again the times shifted. It was about trade. So you see, this is the time when the world is doing trade deals. Everyone is looking at China, America. This is what is defining the world today. It's trade. That's the future. So as an individual, as an organization, as a department, as a country, if you're not strong in technology, the rest doesn't matter. But yes, do not think that this is technology or an economic shift. In my view, it's an intergenerational, cultural, and societal change. And when changes happen at this level, if you do not follow this, you are out of sync with society. In a respectful word, I would say you would be an outcast. You won't be heard, you won't be listened, you won't be followed. So please understand that don't dismiss it as a technology change. It's a societal change. If you still believe that what I am saying is not making sense, let me give you a proof of a near recent history, I would say. 19th century, Industrial Revolution replaced physical labor. The steam engine, the spinning jenny, replaced physical labor. In 21st century, the tech revolution is replacing mental labor. You and I are mental laborers. We don't work, in terms of physical labor in that real sense. This gives you a sense of what you need to prepare yourself for. You need to be mentally updated on what's going on and what will go on. If you don't change, what happens? Very, very important question. Some people will say, hey, look, I have been practicing for 20 years. I'm the best person in this field. I've been a CEO and I've run company through various times and I know what to do. Not really, sir. Not really, madam. I'll give you an example of those who decide not to follow what happens to them. If you're using a computer, if it is not Apple, you will find the logo of Intel on that. Intel became such a big company because it was founded by Gordon Moore, whose slide I showed you in the beginning, the Moore's law, the power of computing. The computing changes every 24 months, doubles actually. They became so big, they realized that, okay, look, no one is going to do anything to us. We are Intel. We power the most intelligent machines. Who can do anything to us? Yes. Look at what happened. When I used to talk previously, I used to tell their first quarter loss was $1.6 billion. Later, they had a $16.6 billion loss, the biggest ever. This is Intel, by the way, the most powerful and intelligent company on computing at a point in time. Still believe so. But their outgoing CEO said, we are out of competition. We are not going to become back in competition anytime soon. So always be reminded. I'll give you more example too. I have too many examples of what I call of tech graveyard. So young chap appears. If you're using any of the phones, you're using OpenAI. He is the one who runs. He's the one whom everyone wants to partner. So there is a very important message also for you here. If you're a CEO of a company, if you're a startup, no one is your competition. You are the competition. This slide tells you a young lad with innovative technology, with a futuristic technology, beats a 70-year-old world leader, hands down, beats them out of competition. You can do that too. If that's not enough, this is a very recent one. All of us have watched movies, we have got inspired by movies. Look at what happened. It's not a very old thing. Netflix acquired Warner Brothers. Warner Brothers is over a century old. Netflix is nearly a quarter century old. If this is not enough, they have acquired Warner Brothers for 18% of their valuations. A 102-year-old company is valued at what? Think about it. So 83 billion versus the peak time was 160 billion for them. And Netflix is 455 billion. This is new age company. It's driven by technology. Warner is a conventional company. You got to take a call whether your practice will remain conventional, whether your company will remain conventional, because your department, your ministry will remain conventional, or will they become digital first? The vision with which I created Academy of Digital Health Sciences, I want each and every one of you to be digital first. So my message to you is, in digital age, pride, ignorance and arrogance have similar consequences. So please make sure that you don't have any one of these and you don't become Intel or Warner Brothers or BlackBerry or Nokia or fax or pager. I can give you examples one after the other. At any point in time, in my view, a digital first company will beat the biggest conventional organization. If you read the book Digital Health Truly Transformational, I have towards the end given an example. Written more than 5 years ago. It's still a testimony to what's gonna come. It tells you the future of what's going to be landing. This course is going to prepare you for how you're going to handle the landing or probably your takeoff to the next level. I would say this message any professional who is confined to a desk job will increasingly cede their role to algorithms. So please master the field of digital health if you are in healthcare. We are with you. As Academy of Digital Health Sciences, we won't let you down. We would always let you lead. Yes. Now this slide sums up the big change on AI, technologies, digital health, whatever say. So on AI side, when the technology came in, there were passive agents. You trained them on the frameworks and they delivered results. Like my CGM, if I just check my sugar, see, it's a very interesting thing that not only I am in digital health is in me. So out of, you can see the smart ring, smartwatch, and my CGM, I have almost 33 sensors in and on my body. So if I check now, I get my sugar. Now the problem is, this is deterministic. It's real time. But if I were to go and ask my CGM, what's my HbA1c, which is going to be a projected one, it's non-deterministic. It's not going to be the same every time. But CGM is going to be same, checking my sugar. Over time, these AI tools, while they were working, they started learning what we have ended up calling machine learning, and they have moved from passive agents to active agents. They are non-deterministic. They will not give you the same results. Like a weather channel will tell you a weather, a projected weather situation for the next year, for the next month, for the next week. But for today, it will be like determinate. It will be like fixed. This is a very big change that has happened. The second big change is Gen AI has moved to multimodal AI. Then large language models have become large action models, and the natural language processing has become natural language programming. You don't need to learn coding anymore. We are very lucky to have one of our board members, Mr. Bakul Patel. Bakul set up the office of digital health at the US FDA more than a decade and a half ago, ran it for 13 years, coined the term software as a medical device, defended before the US Congress, and is one of the most realistic and futuristic thinkers. When we interact with him at the board level and even personally, is fairly clear about the future of health and technologies. And he told me a long time back that the future is of no code, low code. We have reached there now. I think the world is changing so fast that you would be able to create new tools that don't exist today. If you understand that domain, which I'm sure in the last nearly an hour, I would have given you a fairly good sense of where digital health is coming from and where it is headed to. Just giving you the fundamentals. So technologies will move from being deterministic to probabilistic. Technology will gradually replace tasks, then jobs, then people, and finally organizations that don't use technology. So my message to you is, please embrace technology and make it your force. Don't fear it. So I will leave this very important message for you. Technology creates opportunities and opportunities create jobs. Digital health brings phenomenal opportunities, and I believe it will create phenomenal jobs, not because you are at this time, because you will be trained in digital health to leverage these opportunities that come. This will be one of the most sought after skill in healthcare. I call it the great reset. I call it the golden age of medicine. It's going to benefit every person. And I leave you with this message that I gave in 2024 at the Global Digital Health Summit, and I hope to meet you at this annual summit. This is not the age of competitors. This is the age of creators. At whichever level you are working on, make sure that you create and not just be a competitor. And I can bet you that when you finish, if you're taking the long term course, with the course that I take, the last lecture I take, you would get an idea of what is the potential that you are sitting on, what are the opportunities that are there. I believe there'll be no dearth of jobs, there'll be no dearth of wealth creation, and this we will do with ethics and with the quality of care that so far has not been comprehended. So I would encourage you to look at www.digitalhealth.ac.in and enroll for the courses if you have not still enrolled. I hope that you will make the best use of these courses and recommend these courses to your friends and your colleagues. Visit us at www.digitalhealth.ac.in, and I await your feedback, and I hopefully will meet you at some point in time or at the Global Digital Health Summit if you wish to attend. I wish you good luck and wish you very best for your leadership and healthcare.